Okay, being that in-house preferred provider for independent and assisted living communities, these arrangements that you are going to be able to garner a nice steady flow of patient referrals for your companies. Now, in addition, when creating these arrangements, they can be profitable, but at the same time may cause problems for you in the future as well. So I want you to be able to heed these warnings. The arrangements that you are able to create with these potential referral sources, these independent living communities, these assisted living communities, it may be scrutinized a little bit under the federal and state anti-kickback laws. So be careful. So this only happens if you are receiving, patients with. Remember, violating the federal anti-kickback law can result in a $25,000 fine per incident, possible 5-year imprisonment, or even both. You could also be barred or not allowed to participate in the future in any federal healthcare programs. Look, we're repeating this all the time. The federal anti-kickback statute prohibits any kind of rewards or compensations in exchange for referrals of clients covered by the federal healthcare program. If you are going to be that preferred provider of that independent or that assisted living community, understand that it doesn't guarantee anything that you will serve all of its residents. You need to know that. The advantage of being an in-house preferred provider is that your company will always be there, and therefore will have plenty more opportunities to be able to take the cases, to be able to get those referrals from that community. Despite any challenges at any problems that may arise, understand that it's not illegal for any private duty, let me say that again, okay, let me repeat it, private duty agency to be that in-house preferred provider for any independent or assisted living communities, okay? As long as your relationships with those communities abide by the law, okay? Let me go ahead and share with you 2 tips that should help you successfully maintain relationships with these communities and to ensure that you generate referrals. 1, you need to always be prepared for competition from other independent contractors out there within that facility who can either underbid your private care agency, at the same time as residents prefer independent contractors because their rates are normally cheaper. You'll have to differentiate yourself from others out there, and you need to promote your agency's advantages and what you have to offer more than the other companies, and to be able to show that what you're charging is worth more than what you are providing. I will discuss with you guys in the future videos on how to be able to still charge a good rate for your private duty services without having to lower your rates. One of the biggest things to do is this. You can keep your rates at a decent level, but be able to provide more valuable services, more valuable products that can be offered to your clients, to be able to show your future clients, their family, as well as the facilities administrators and your servicing, that your company provides more than the rest of the competition out there. Look, just like at the same thing for home health agencies that accepts Medicare patients. When you're out there, what you need to be able to do is provide more services than the typical home health agencies out there. Agencies out there will always say the same thing. We offer therapy, we offer skilled nursing, we offer home health aid, speech therapy, MSW. Okay? We have a diabetes program, we have a CHF program. So what? This is what everybody should be offering. What else do you have or can you provide that's better? Do you have a medication reminder program? Do you actually offer telehealth? Do you provide emergency buttons out there? Look, there's a variety of additional things that you can actually add to your program that's going to make it stand out from the rest. Other agencies are still deciding to just keep the same core products and services when they should actually be thinking about adding additional more products for several reasons. Look, your patients are going to be better. They're going to want to stay home longer. You're going to be able to prevent things through like telehealth, for example. You're going to be able to do all these things and prevent the patients from having to go to the hospital, meaning you're taking care of them. You're doing your job by reducing the readmission rates. You're doing your job by making sure you keep them healthy. By adding these products and services, it's going to be ultimately helpful for your company. If you want to be able to know more, just keep on watching our videos. Congratulations, because we're going to be giving you guys so much more information that's going to be able to make your agency a more valuable agency compared to the rest.